Welcome to the Borno Health Update. I'm your host, Ibrahim Amara. On the program, we track the advancements in the healthcare under Governor Zulum's administration. In this program, we focus on the transformative efforts spearheaded by Professor Baba Malam Gana, Commissioner of Health and Human Services, who is driving innovation and resilience in our healthcare systems. No single meeting, regardless of its duration, can fully capture the scale of initiatives and actions Governor Zulum has undertaken in the healthcare sector. This week at biennial meeting and digital conference of Women Doctors Association, the Commissioner for Health, Professor Baba Malam Gana, outlined the Borno State government's multifaceted approach to revolutionizing healthcare. He stated that Borno now boasts truly befitting health infrastructure and will soon declare a data-driven state of emergency in the sector to ensure accurate and tangible results from these massive investments. Let's hear directly from the Commissioner.
The objectives of this presentation are here. We're going to look at the current health sector landscape in the state and also our priorities in maternal and child health, and share with you some of our results in terms of innovations approach that we have started in terms of maternal mortality and neonatal mortality. Let me appreciate His Excellency, the Executive Governor of Borno State, Professor Babagana Umar Zulum, a compassionate governor, a people's governor who has always had the heart in his heart, the health care of the people of Borno State. He has, in the last 2 years, been putting 15% of the budget to healthcare. This is in line with the Abuja Declaration, where all the countries in Africa came to Abuja and discussed what is the way forward for the Africa in terms of healthcare landscape, and they figured 15% budget is the ideal. So for the last 2 years, we've been able to achieve that in the state. He's also bought into the insurance scheme, where currently we have 94,000 people, but at the end of this month, the formal sector will join this Borno State contributory agency, so that our numbers will swell up. I just want to highlight to you here, under emergency response, we have SEMSAS. SEMSAS stands for State Emergency Medical System and Ambulance Services. We have launched SEMSAS indeed by the federal, by the coordinating Minister of Health, was in Maiduguri last year, and together with the governor launched our brand new ambulances. And these ambulances at present are focused only in Maiduguri area, MMC, Jere and Kondiga area. And these are ambulances that we have a toll-free number. You can call the ambulance, and as Professor Hadiza has said, there are many delays or Ds in terms of maternal mortality, one of which is the ability to the pregnant woman to take herself to a facility, especially in the middle of the night. So in order to overcome this delay, we have launched ambulances with toll-free numbers, which at any is 24/7. So at any point in time, a woman who is in labor can call that number. We have a tracking system. We can identify where she is, and the driver will go to her, and we can track the driver and see where he is going. If he's going in the wrong direction, we'll call him and reprimand him. So this is one new innovation that we have started in the state. I also want to highlight to you that we have the State Drugs and Medical Supply Agency, BOTMA. Both SAMSAS, which was established last year, has last week received awards from the federal government because our own is the most digitized agency. And the Drugs and Medical Supply Agency has got a pharma-grade warehouse, and it's only been established for 1 year, and because of it's fully digitized, it's got 24/7 power supply through solar, and it got lots of checks and balances that we have received 6 awards within just 1 year. And we are actually supplying to the last mile. So whether you are in Shani in the southern part or you are in Damasak in the northern part, will reach you. And don't forget, Borno State has been implementing free maternal drugs, and also we've been giving or implementing free cesarean section now for quite some time. At the moment, we have 390 primary healthcare centers operational, and in terms of general hospitals, Borno State has now gotten 50 general hospitals spread across the 27 local government areas. Even this year alone, in Maiduguri Metropolitan, we are building a general hospital in Kadiri. We're building an orthopedic hospital here in Maiduguri, and we are upgrading Malay General Hospital to make it, a full-fledged general hospital. And we have recently recommissioned the Brigadier Abakari Hospital, where cesarean section is now being done, as well as neonatal care. As a matter of fact, we are very soon about to have an MOU with Zipline. Zipline is the use of drones in supplying medical products to very hard to reach areas. This will be a game changer, especially in some parts of the state. So our vision includes improved maternal and newborn health outcomes. We want to strengthen our health systems, including having a robust emergency care networks throughout the state, and increase community ownership of maternal and newborn health, and of course, sustainability. So our challenges include system level, community level, and data and monitoring. Data is our weakest link, and very soon we're going to declare a state of emergency on data because it's our weakest link, and without data, the current swap or sector-wide approach, you will not get reimbursed in many things.
To make the audience understood the government investment in the healthcare sector better, the Commissioner outlined key efforts to resolve the state's shortage of medical staff and health professionals.
We are working on infrastructure. This year alone, His Excellency, the Executive Governor, has revitalized, re-energized 135 primary health cares in the state. We have a limitation to health care workforce. As a result of this, we have established a Kashim Ibrahim State University Teaching Hospital, here in Maiduguri, and it's a state-of-the-art teaching hospital. Those of you who have not seen it, please do visit. And we have also got a medical college there. Students have already been admitted. As a matter of fact, about a month ago, the Medical and Dental Council of Nigeria came and fully accredited our teaching hospital and medical college. Furthermore, to overcome this health workforce inequality, because as a result of insurgency, we lost 45% of our healthcare facilities, and a lot of our staff or health workforce either ran for their dear life, some were abducted, etc., or post-traumatic stress disorder, as a result of which we have to build and bring Borno bigger and better. As a result of this, His Excellency, in his magnanimity, decided to construct a state-of-the-art College of Nursing and Midwifery in the northern senatorial zone in Monguno, and also a College of Nursing and Midwifery in the southern senatorial zone in Goza. And this gives Borno State 3 colleges of nursing. One is in Maiduguri, which was established in 1977. Now, if I tell you how this is going to change the demographics or the landscape in terms of healthcare, the Nursing and Midwifery Council came here about 6 weeks ago. They went to Monguno and within 1 hour gave us full accreditation. And we have already advertised for students, 300 students in College of Nursing Monguno, and also 300 students for the College of Nursing in Goza.
That was the Honorable Commissioner for Health, Professor Baba Malamgana. The keynote speaker at the event, Professor Hadiza Abdullahi Osman, delivered an extensive address on the rising of maternal and infant mortality in the country. She emphasized the urgent need for collective action to address this critical issue.
We started M1 around 92, and we are calling for ladies to come up. We hardly have 2, 3 to come up for meeting. When I walked into this hall today and I saw the vast number of females that are sitting here, I feel so proud. So proud because when we started residency, we were told all stories. We are not supposed to be here. We are too ambitious. We should just grow up as medical officers and face our families. And here we have to have stopped counting the number of residents I produced. Thank you very much. Let me come to the topic of the presentation. I want to most sincerely appreciate Medical Women Society. Mr. Chairman, sir, please, sorry I got emotional, permit me to start my lecture. For giving me the honor and privilege to discuss this topic. They take this act and right, and whoever chose this team have thought it wise to bring this team for this particular age. From pain to progress, Nigerian women leading the way against maternal and perinatal mortality. I've lost count of the number of presentations I've had on maternal mortality. We are giving, but we are going to be giving our women so that we save their lives. I always love this quote by one of our renowned professors of obstetrics and gynecology of international repute, that our mothers are dying not because of disease. We cannot treat it. They are dying because the society did not see the value in saving their lives. I want us to close our eyes for a few seconds and imagine a world where we wake up and no woman died while giving life to somebody. Can you imagine?
Bluetooth
Is it possible? Yes, it is, if we do the right thing. The next slide. The sad story, as usual. All the time. Nearly all the deaths, 90, 95, 99% of the mortalities are from low and middle income countries. Sadly, nearly all these deaths can be prevented where the clinical knowledge and technology required to prevent them have existed or have existed.
In the opening remarks, the executives of the Women Doctors Association M1, Borno State Branch, expressed gratitude to all attendees for gracing the event and reaffirmed the association's unwavering commitment to supporting initiatives aimed at reducing maternal mortality nationwide.
To this important gathering, and I sincerely thank you for honoring our invitation despite your very busy schedules. Your presence here today is not only a mark of support for M1, but also a powerful statement of shared commitment to improving the health and well-being of women, mothers, and children in our society. This year's conference is anchored on a theme that is both timely and deeply relevant: from pain to progress. Nigerian women leading the way against maternal and perinatal mortality. This theme captures a painful reality we are all too familiar with, especially here in Borno State and across northern Nigeria. Maternal and perinatal mortality remains among the most pressing public health challenges facing our nation. Behind every statistic is a woman who labored in pain, a family shattered by loss, and a future altered forever. Yet our team does not stop at pain. It moves deliberately towards progress. It recognizes that Nigerian women, particularly medical women, are not merely witnesses to this crisis. We are leaders, innovators, advocates, and change agents in the fight against it. As medical women, we stand at a unique intersection of science, compassion, and service. We understand the clinical causes of maternal and perinatal deaths, but we also understand the social, cultural, economic, and systemic barriers that sustain them.
Today is not just another date on the calendar, it is a landmark in our collective journey. Your presence here elevates this gathering, and for that, I extend my heartfelt gratitude. On behalf of the Medical Women Association of Borno State, executives, and our entire membership, I thank you for honoring our invitation. Your attendance reflects a shared purpose, a commitment to improve maternal and newborn health, and to also amplify the voices of women in medicine and all over the world. Our theme for this year, From Pain to Progress, Nigerian women leading the way against maternal and perinatal mortality, speaks to an urgent national reality. Too many Nigerian women still face fear, risks, and preventable tragedy in the process of giving life. Too many newborns do not live long enough to experience the promise of tomorrow. These losses are painful reminders of the system gaps, delays, intervention, and social inequities. Yet, in the midst of this pain, we choose progress. In the face of this challenge, we choose courage. And in the shadow of losses, we choose leadership. Nelson Mandela said, "It always seems impossible until it is done." Today, we gather to reaffirm that reducing maternal and perinatal mortality is not only possible, it is within our grips when women lead with knowledge, compassion, and unwavering resilience. This conference is more than an academic exercise. It is a call to action. It is a reminder that every life is one too many.
The Women Doctors Association honored the Commissioner for Health, Professor Baba Malam Gana, in recognition of his relentless efforts to combat maternal mortality in the state. Also honored was the Executive Secretary, Borno State Geographic Information Service, Bogis, Engineer Adam Bukar Bababe, among other distinguished guests.
Distinguished Professor Baba Malam Gana was a consultant urological surgeon at Highwell DDA University Hospital, United Kingdom, until he was called by His Excellency Professor Baba Gana Umar Zulu, the Executive Governor of Borno State, to come and serve his fatherland as Commissioner of Health and Human Services. That is the position that he has been honorably occupying for the past 2 years. He attended the Bulagulim Primary School, Maiduguri, and Yerwa Secondary School, Maiduguri. Also, School of Basic Studies, Ahmadu Bello University, Zaria, and proceeded to Faculty of Medicine and graduated with MBBS at ABU Zaria in 1983. He was awarded Pediatric Association of Nigeria Prize as the best graduate. Please, a round of applause as the best graduate, please. Now, after the National Youth Service at Cross River State and a brief stay at State Specialist Nursing Home, Maiduguri, he left for the United Kingdom. He commenced his postgraduate training at the University of Newcastle upon time Medical. He underwent training in surgery and urology in Dundee, Scotland, London Institute of Urology and Wales, leading to prestigious recognition as fellows such as Fellow of the Royal College of Surgeons, United Kingdom, Fellow of the West African College of Surgeons, Fellow European Board of Urology, Fellow of Collegiate Board of Urology, United Kingdom, the first to have attained this in the whole of northeastern Nigeria. Also Fellow of Higher Education Authority of United Kingdom, Fellow African Institute of Public Health, Fellow of the Academy of Medical Educators of United Kingdom, Fellow of New York Academy of Science, Fellow of International College of Surgeons. All these to mention but a few. As a urologist, Professor Baba Gana has conducted research in areas like hematuria and incontinence and has published over 45 papers in peer-reviewed international journals. He was editor of BMG West Africa. He has made over 40 presentations in scientific conferences that cut across the globe in Europe, the United States of America, India, and in Africa, etc. He has received several awards, including the Best Visiting Professor in Sudan for 6 years, and was given an award as the best by the Muslim Council of Wales, United Kingdom. As a Commissioner of Health, in his role as Commissioner, he has been actively involved in addressing health challenges and has brought about reforms and innovations in Borno State, such as flood response. He has worked, flood response. Professor Ghana team work approach worked very well during the flood in Maiduguri. This major disaster management was led by the Ministry of Health under his able leadership. and also in collaboration with partners by the provision of health outreach to flood-displaced communities, 40 internally displaced camps, and provided support to affected populations. The provision of 1 million doses of cholera vaccinations to the flood victims saved many lives. Under maternal and child health, he has introduced the Safer Box Bundle of Care, which aims to improve maternal and child health outcomes, the maternal mortality reduction innovative initiative, the emotive bundle in reduction of maternal mortality. He also introduced emergency medical transportation and ambulances services in Borno State. He helped in setting up of the Borno State Drugs and Medical Consumables Agency, which has received several awards. He also assisted in setting up digitization of health facilities in Borno State. He is the current chairman of the Northeast Commissioners of Health Forum, a position which he uses in combating maternal mortality and pooled drug supply in the Northeast. He has helped in increasing human resources for health with the establishment of brand new colleges of nursing in Mongono and Goza, which are fully accredited and about intake of students. Also in the Kashim Shettima State University, Kashim Ibrahim, this should be Kashim Ibrahim, State University Teaching Hospital and Medical College that is about to be commissioned. It has received accreditation from the Medical and Dental Council of Nigeria, courtesy of Professor Baba Malam Gana as Commissioner for Health. He also introduced clinical governance and the WHO approved practical access to core kit to Borno State to bring about attitudinal change amongst health workers. He also assisted in bringing the salaries of the health force to be at par with the federal government, just like he mentioned when he was making his presentation. Distinguished ladies and gentlemen, I present to you distinguished Professor Baba Malam Gana for his award. And to do the honor of presenting the award to the distinguished professor, it is my singular honor and privilege to invite the representative of the Vice Chancellor, University of Maiduguri, Professor Baba Gana Bago, please. So kindly come on stage. Please a round of applause for them all. Thank you.
This is an award of excellence presented to Professor Baba Malam Gana, Honorable Commissioner for Health and Human Services, Borno State, in recognition of your exceptional leadership, unwavering dedication, and outstanding contributions to advancing maternal and child health care in Borno State, and for your support to M1 Borno.
Thank you for joining us. Stay tuned for the next week's update, where we'll explore more innovations in the healthcare sector. This is Ibrahim Amarawa reminding you, health is wealth, and Borno is on the rise.